Last day, I had a patient with complaints of chronic cough. He's attributing it to an allergic cough. Like whenever he is exposed to a dust, smoke, and perfumes, the cough develops and it lasts for long time, and finally it ends up in blackout. There were multiple episodes, multiple attacks of coughs, which resulted in fall. And he's having many wounds here and there due to this loss of consciousness, and there is sudden fall. And when I took a detailed history, he started having these symptoms since past 2 to 3 years. And there is daytime dosing. He was obese, and rather than obesity, he had a lot of fat around his neck area. While examining, his neck circumference was more than 50. I could barely see his airway while throat inspection, and that was so much compromised airway. No doubt that he has difficulty in sleeping. He's having diabetes and hypertension, dyslipidemia, and his daily routine activities are badly affected. And even with chronic anti-allergic and anti-asthmatic medicines, he's having this cough. He was very much tired. He was disappointed, desperate, and all his family members had came to me. And while examining his chest, it was normal. It was clear, except for there is a severe airway compromise. And I explained that it is due to his obesity, due to his airway compromise, he is having OSA, obstructive sleep apnea. And this OSA has resulted in the metabolic syndrome. He started having hypertension, diabetes developed, dyslipidemia developed, and everything became abnormal. And this becomes a vicious cycle. And by this time, he developed respiratory failure because of hypoxia and carbon dioxide retention. And that caused the recurrent episodes of blackouts, that is, the loss of consciousness after bouts of coughing. Here, the patient needs motivation to weight loss. He needs CPAP machine during night, and maybe he might need an oropharyngeal reconstruction surgeries and other comorbidities management like diabetes, hypertension, and dyslipidemia.